Hey there, welcome back to the Complicated Kids podcast. I'm your host, Gabrielle Nicolay. I am a toddler whisperer, a speech therapist, and a parent coach. And today I have Sophia Galano. Sophia, welcome.
Thank you so much. I'm excited to be here.
I'm excited to have you because we are going to talk all about the anxious teens, probably their parents too.
Yep.
But before we do that, tell the good people a little bit about who you are, what you do, and do tell them about your book that's coming out.
Perfect. Thank you so much, Gabrielle. My name is Sophia Galano. I'm a licensed clinical social worker. I have a private therapy practice. I have worked as a therapist in a number of settings with teens and their families. So at schools, both independent public schools, residential treatment centers, outpatient centers, hospitals. And I've been working with teens and their family for over a decade now, and really working with anxiety, working with the teens and working with their families. With a teen with anxiety is really my bread and butter. That is my specialization. I love it. I'm super passionate about it. So much so that I have written a book about it called Calming Teenage Anxiety, A Parent's Guide to Helping Your Teen Cope with Worry. My intention of the book, and I'm sure we will talk more about this today, is really to provide a blueprint and a guide for parents who really need some tools and skills on how to help their teen with anxiety. So my work is really focused on what parents can do, what would be helpful not to do, what they can say, and what is helpful not to say. So I like to go into very specific examples and really give parents the resources. We often know that anxiety in teens is a problem, but then what do we do with it? And that's really my hope. With my book, my work as a therapist. So I'm excited to chat more about it.
Yay. Okay. So before we start, because I can already hear the audience being like, she needs to tell us what to say and what not to say. So we're going to get there. I think it might be helpful to situate the discussion in what anxiety is and what anxiety isn't. And
Yes.
this question of like, is it a problem? Or
Right.
when is it a problem?
Right.
So we want to
Right.
talk about that a little bit.
Yes. I really appreciate you asking that question because this is usually where I start as a therapist. And often I have parents that reach out to me asking the same thing. I mean, I want to preface by saying that teenage anxiety is really easy to overlook. And even the most meaningful, caring parents often disregard a teen's anxiety because it can be very challenging to recognize. A teen I also want to say a teen is not an expert communicator. So oftentimes, I really want to emphasize that a teen is not an expert communicator. So oftentimes, a teen is expressing that they are suffering, but it's easy to be misinterpreted. So oftentimes, a teen's anxiety can be disregarded or labeled kind of as teen angst, or my teen is really moody, or my teen's just kind of going through a phase where they're just withdrawing, acting out, kind of just not being themselves, but that's sort of natural for adolescence. And sometimes it might be, but oftentimes it's not. So, I do a lot of work with parents that, when they recognize that they might have disregarded it or overlooked it, to practice a lot of self-compassion, that it's understandable to miss it. So really where I begin is recognizing anxiety. How often is the anxiety occurring and to what extent? So really, I give this example, it's kind of a standard example, but let's say there's a teenager who is anxious before a math test. They're feeling nervous, they're feeling stressed. They go in, they take the test. It's okay. Okay, sure. That's pretty kind of standard, natural, I don't want to say normal, but natural, a natural feeling a teen might experience. If there is a teen that is so nervous before every math test that they're refusing to go to school, they're throwing up, they're having panic attacks, it's affecting their other classes, it's preventing them from socializing, that's when we're going to want to take a deeper look. So really it's about assessing, again, I'm, repeating myself, but it's important to emphasize this, assessing how much and to what
Mm-hmm.
extent this is
Mm-hmm.
occurring, and again, if let's say this happens once a year, okay, team might have just been having a bad day. If it happens once a week, multiple times a week, maybe even a couple of times a month, that's also a time where we want to pause and really look in to see, is this worth taking a deeper look.
Yeah, I like to think about this. I think about this in terms of speech and language as well, as like quality of the
Mm-hmm.
experience and quantity.
Yes.
So
Yes.
like,
Well
right
said.
to your point, how often and what's the impact? What's the degree that's going
Yes.
on? Because
Yes.
you described it quite well. Okay, so we kind of understand there's a point, and probably it's a sliding scale slash spectrum of
Sure.
anxiety. Anxiety is a normal human emotion, um, all the way up to I'm throwing up, I'm failing all my other classes, I'm not coming out of my room, and I'm telling my parents I hate them.
Right. Right. I'm sure there's a lot of listeners out there who are like, I've heard that before. Yes.
Yeah.
Yes. Mm-hmm.
Okay. And so, what, to the degree that we're talking about sort of mostly, you tell me, mostly clinical manifestations of anxiety, in other words, the kind that impacts my life negatively.
Yes.
Okay.
Yes. Exactly.
What are some helpful ways to think about that? And what are some less helpful ways to think about that? In other words, what are parents missing when they're maybe not recognizing the fact that no, this actually merits attention?
Yes, yes. So again, just to reiterate this, that teens are not the expert communicators. To remind parents to remind themselves that oftentimes the teen is expressing that they're suffering, and it's important to listen. And I work with parents a lot around this, kind of one um, conundrum, we'll call it that, which is that it's very natural for parents to immediately want to jump in and fix and provide a solution. So let's say they get to that point where they realize, okay, something is going on here. Something's not quite right. How do we fix it? Like what do we do? Again, that's so instinctual for us as parents. Like we want to alleviate the problem, right? When from the get-go, we don't want to wait. It's really, really important for parents to practice active listening when they recognize that their teen is struggling, and a little bit of a, it kind of wrap your head around as a parent. It sounds kind of strange, but that listening actually is providing a solution and actually is fixing. It's just a little bit longer, less immediate. We don't kind of get that instant gratification as a parent of like, oh, we've solved the problem and it's gone. But for parents to really keep that in mind, that oftentimes when a teen is communicating with them, they might not be using the communication tools and skills as an adult. And therefore, it's even more important for the parent to listen, that it's really, really essential. And that's going to help the teen feel very heard, feel validated, feel seen. And often they don't really want to be fixed, that kind of pushes them in the other direction, which, is frustrating for both the teen and for the parent, and then, that's where often it's like, well, I've tried to help. What do I do now?
Okay. And as you're talking, I am hearing the distress tolerance of parents be
Mm-hmm.
maxed out by their
Yes.
child's emotions. So, do you want to talk
Yes.
about like what happens there and what adults can do to either, start feeling their feelings and accepting that, blah, 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 like all it's
Right.
sketch this out for us in terms of when you've got adults who can't handle, because this is, I think, in part at least,
Yeah.
why we go to fixing so much,
Of course.
right? Because
Of
it's very
course.
distressful to
Right.
see one's own child in
Of
distress,
course.
and
Of
we want to
course.
fix it. And so part of why we're fixing is because we want to feel better.
Yes, of course, which again is so valid,
Yeah.
that like
Yeah.
like I said, I think it would be unusual for a parent to be okay seeing their child suffering. In fact, anything, we can look at it as that's more concerning if a parent's like, oh, it's fine watching them suffer. No, so again, parents are coming from a really good place that it's hard for them to see their child suffering. And adolescence is such a tricky time, not just for the teen, but for the parent, because the parent has raised this child up into that point where they really did need to provide solutions and they did need to fix it. Like, a 7 or 8 year old they need solutions, they need things to be fixed. And then, when we think of, us as humans, as adults, we often go the opposite. We don't want someone to fix things for us or provide solutions or tell us what to do. I mean, there are some cases where yes, we like it, we benefit from it, but we really value being heard and being listened. So it's really hard for parents that in this kind of middle, like kind of gray area of adolescence where it's like, wait, I had just raise this child where I was fixing and providing solutions. My kid falls down, I give them a band-aid, I kiss their knee and make it better. And now they're emerging into adulthood. I have to kind of sit back and watch and listen and be patient while they slowly get, better or heal. And it's hard, so there are a lot of tools that I list in my book for parents to kind of practice on the day to day to kind of help them get through it. Really, again, like I encourage parents to begin by reminding themselves that listening is fixing. Again, I know I'm repeating myself, but there's a purpose to it.
I love that.
Just to
listening is fixing.
Yes. And we might not want to say that to the teen. We're not saying, hey, I'm listening to you because I want to fix you. That's never going to go down well. But we can keep it in our minds, that actually what I'm doing is providing a solution in the long run. And that's why it's really important for parents to be compassionate with themselves too, that they will, I don't want to say need their own support, but will benefit from their own support, and also being non-judgmental towards, maybe things that they might have, I don't want to say done wrong in the past, but if they've, let's say, gone into more kind of fixing or solution mode, that it's okay, practicing non-judgment, practicing self-compassion, having their own support too. Parenting an anxious teenager is so challenging. And oftentimes parents will disregard their need for their own support. They're not getting their own counseling or coaching or therapy. And it's so important for them, to practice their self-care and to do things that can really help them feel less stressed.
Today I was working with a client, and it came up in the session. We both were feeling kind of embarrassed. And it was one of these, it happens, right? And it wasn't until I went to coaching school where I was like, oh, right. Feeling your feelings is actually not going to kill you.
Right.
Which is how it kind of feels at first.
Right. Yes.
I mean, we are
definitely
so used to being like, well, no, I don't want to feel that way. Like, right. And so we both sat there and I was like, okay, guess what? We're going to take this moment. This is a prime example. We're both just going to sit here and feel embarrassed.
Yeah.
And realize that neither of us is going to die.
Right. Right. That we're going to get through it.
Right. And so the reason I bring that up is kind of in the same vein, right? Which is like, yeah, I can be in turmoil about my child's turmoil.
Yes.
And still listen and still be present, and then take that somewhere else. That, right. My turmoil is not my child's problem to resolve.
Right. And oftentimes that gets disregarded and by well-meaning, concerned and caring parents, because they're used to prioritizing their child's needs, that their needs kind of come second, which, there's, a time and a place for that, of course, but it's important for parents to take care of themselves. And also, there are going to be times where they don't feel as patient, where they're like, I'm tired of this and I want to fix it. And I do want to throw this out there. It's always important for me to mention, while I'm speaking about this topic, that there, of course, are situations where it is appropriate to fix and provide solutions. Let's say you have a suicidal teen or a teen self-harming or there's severe substance use. Of course, for the sake of this conversation, I'm speaking more about kind of general anxiety, and if there's a situation like that, then yes, of course, it's appropriate for a parent to intervene.
Yeah. Health and safety.
Yes, 100%. I always just like to throw that out there. It's always important to remember when we talk about this, that each teen is different too.
Yeah. Okay. So listening is fixing. What should parents not say?
Okay. So to start, and this is a tough one for parents, because I also want to preface with this, is that the parents are right when they say these types of things. Oftentimes a teen will say, Mom, Dad, I'm so stressed out. Like, I can't sleep. Everything sucks. I hate everyone. And the parents they say, well, have you tried meditating? Have you tried going out for a walk? Yes, let's be real. Those are actually great strategies and great solutions. So putting that out there, and it would be very helpful for the teen to do that. But unfortunately, again, those are kind of minor ways that parents often fix or provide solutions. And it's not even this grand solution of like, okay, well, let's talk about switching schools. Let's talk about getting you into therapy. It's like these kind of minor solutions or strategies, which can help the teen feel very disregarded, which is not what we want. We want the teen to feel validated. So that's where it's important for the parent to say, okay, even though these solutions and strategies are actually really good, this isn't the time and the place for it. And also making time and space to really have a conversation with the teen. So oftentimes, again, well-meaning parents, and it's stressful being a parent, will have, a very short window where they can talk to their teen, and then a sibling comes in or they get a work call, and then the conversation's kind of cut short and the teen shuts down. The teen's like, okay, well, clearly this isn't that important, and it kind of pushes them farther away. And again, it's not intentionally harmful on the parent side. It's just their, it's kind of life gets in the way. But it's very important for parents to make sure that they have the time and space to talk to their teen when there's no interruptions, when they know also that they're in the right headspace. Like if they know that they are exhausted, they had a horrible day at work, they're not going to be present for their teen, that it's okay to also not be on in that very moment, and to even communicate to the teen of saying, can we talk about this at this time or this place when I can be more available for you?
Because inevitably that time is like 11:30 p.m.
Right. The coffee is worn out. Like it's just,
yeah, it's all over. And lots of kids, I think this is probably true of teens generally, anxious teens for sure, or other forms of neurodivergence as well, which is like, that right before bed is as they come down from their day.
Yeah.
They start talking, which is great in some ways. And if you're fried, is not so great for you.
Yes, totally. And it's important that, when, we find that balance, and, I talk about so much in the book is like this idea of balance, where it's like, we want to jump on any opportunity where the teen is willing to talk to us, because sometimes it's so rare that when we have those moments, it's like, oh yes, I like finally, But it's also okay, if that moment doesn't come at the right time for the parent, where the parent just knows they're not going to be present and it's actually going to be more harmful to the teen. It's okay, we can find other ways to start a conversation or to get a teen to open up.
Well, and this is a really interesting point too, I think, which is I think of it as going from manager to coach, right? Which is what's happening in adolescence for parents.
Yes.
Being able to show a few of your cards as to how we adult around here.
Right.
Like we say when we're too tired to have this kind of conversation.
Yes.
Right. We don't martyr ourselves
on
behalf of somebody else's nervous system. Now, again, this is easier said than done. And you and I can sit here. We can sit here on a podcast and talk about it. But so, doing this in real life is hard, but also really important.
Yes. And it sets an amazing example for a teen. And that's something that, I talk to parents about too, when they have a particularly resistant teen, when, like you said, we can sit here and talk about all of this, but I'm sure there are people listening who are like, hey, like that's great if a teenager would talk to me. Many teenagers won't even begin to open up, and it's where do the parents go from there? And what can be really empowering for those parents? I mean, for all parents, but particularly parents when they have a resistant teen or a teen that's not open to communication, is for the parent to really lead by example and to practice modeling. And that's an amazing way of what you just mentioned, Gabriella, of hey, this isn't the time because I'm really tired. And that also teaches the teen, hey, it's okay for me to also say no when I'm really tired, or it's okay for me to take care of myself. And it's subtle, and for parents to remember that a teen, rarely, I mean, I haven't met one yet, but I'm sure they're out there, but a teen is most likely not going to say, Mom, thank you so much for saying that. You're setting a great example to me. It's happening behind the scenes, and for parents to remind themselves that it doesn't go unnoticed, but the teen is most likely not going to verbalize that to them. So to not get discouraged if they continue to lead by example and they're not seeing or hearing their teen express gratitude or appreciation. I mean, wouldn't that be wonderful, right? If all the 14, 15-year-olds did that out there, but still.
I'm not sure that we would, I'll speak for myself. I'm not sure that I would have become a parent had I known how much sleep I was going to lose
Right.
and how kind of underappreciated
Right.
I would feel in any given moment.
Right.
And,
It's the hardest job.
it's very, very difficult. And I think the image of parenthood these days, anyway, and especially because we think about it so damn much. Like my parents did not think about being parents. It was what you did. You squeezed out some babies, you fed them and you put them to sleep and you sent them to school. And that was kind of the end of the conversation, right? These days, we're all like thinking about it so much.
Yes.
And then we're realizing it's kind of unrewarding most of the time.
So I say those kids are the hardest bosses we have, right? And also, the teens today are living in such a different world than we were living in as teenagers, that it's wild to just even notice that. Like, I appreciate that example that you gave of like, this is how parents used to parent. It's like, are kind of the basic needs met, and now it's so different. But think of our world, and I talk about this a lot in the book, but now, teens are navigating, social media, technology, more academic competition, collegiate stress. Like there's so many new factors here that I think are just these kind of like invisible forces around us in our parenting. And yes, it's tough for parents because most likely they're not going to feel appreciated on the day to day, or maybe, when they're teenagers in their 30s, maybe they will. But looking back on it, but at the time, it can feel discouraging, and that's where I encourage parents to just remain very patient and again practice their own self-care, practice self-compassion, because you're working with most often you're working with someone who's not going to say thank you so much. That means a lot to me. I mean, again, I can't say that for every teen. There are some teens out there that will say that, but again, teens are not expert communicators. They don't know to say that. That's not instinctual for them.
Well, and this feels like a really good time just to point out again, adolescence. I mean, there's some really interesting neuroscience happening with adolescence, but there is no other time except infancy and menopause.
Yeah. All these fun phases, right?
All these fun phases where the brain is changing as rapidly. Like if we want to talk about like, oh, teenagers are moody. No, teenagers' brains are undergoing a major renovation.
Yes. Thank you. Thank you so much for emphasizing that, because often we forget, and I talk about this too, again, like the bulk of my book is more like the tools and the skills, but it is really important to know what's going on behind the scenes, like what's causing all of this anxiety. And yes, we have all these, kind of newer social, cultural concepts that I was mentioning before, the social media technology, but then we do have on top of it, these kind of like classic causes to anxiety, like the brain development, genetics, chemical changes. And I always encourage parents not to overlook the importance of also consulting with a physician and making sure that there isn't anything, other than kind of the standard medical changes that are going on in adolescence that you just mentioned. But oftentimes there are, there's something more biological or medical going on here too. And also for parents not to get discouraged if, let's say, my teen won't go to therapy, my teen won't talk to a therapist, my teen won't open up to me, and let's say they haven't even thought of checking in with their teen's physician. And again, it's easy for us to forget that there are all of these changes going on. So that's a really helpful tool for parents to keep in mind, that oftentimes it is medical or it is biological, and not to overlook that.
Yeah, I think this is a different conversation perhaps, but we also overlook the impact of diet.
Oh, yes.
On mood generally. Yes. And like if we're adding lots of hormonal changes, lots of growth, and then we've got like a diet that's maybe not so great for brains.
Right.
We're kind of messing with stuff there too. So again, that's probably
but I appreciate it. I take more of a holistic approach to this, that it's not just, okay, a teen has anxiety, let's get them in therapy. There's more to it, that even if, let's say it is something, and I'm not a medical doctor, so it's a little out of my scope, but let's say it is something kind of more biological, or chemical, it is still important to consider these other factors. Like, is the teen exercising? What is the teen eating? Is the teen sleeping? If, what's going on in those areas of their life? Is the teen just like in front of their screen all day? Is the teen not seeing any sunlight? Like, what's going on here? Like, let's not overlook those factors.
About, you mentioned sunlight. Talk to me
Mm-hmm.
about these kind of holistic, soft, whatever you want to call them, adjunct
Yes.
recommendations that you're making for parents. Like, my guess is
Mm-hmm.
you have a list. I have a list.
Yes. Yes.
um, Run it down a couple items, because these are things that people can do now without necessarily, right? These are the things that you and I have in mind, I suspect, are things that are good for human beings generally.
Right.
Okay.
All of us. All
Yeah.
of us. Yes,
Yeah.
totally. And just to state too that, every teen is different. So,
Yeah.
I remind parents never to force
Yeah.
any of these on their teen. And, again, of course, unless there's some sort of emergency situation here. But, I talk about, my book, like resources such as exercise, of course, different forms of exercise, like yoga, meditation, mindfulness, oftentimes, and takes with a grain of salt because it's not for everyone, but sometimes there are forms of, energy healing that really resonate with teens that can be really helpful for them. Different types of therapy. That's another piece too, that often, and I'm like I said, I'm an LCSW. I don't want to say I have traditional therapy practice, but at this point in time, but that's not for all teens. All teens don't want to sit in a room with someone and just talk face to face. And that's where I'm like, let's consider other modalities. What about art therapy? What about drama therapy? What about, walking therapy? What about coaching where you're kind of out and about and you're meeting kind of in more casual settings, so I very much come from this place of talk to the teen and brainstorm different options. Like, think of different resources other than like, okay, you're going to a psychiatrist, you're going to a therapist, and that's it. What are some other modalities? And again, just recognizing that it might take a bit of searching, and I call it searching and shopping, for your teen to find something that feels good for them. So for a parent, they're like, yoga is the best thing ever. It saved my life. And the teen's like, wait, I have no interest in that, but actually martial arts sounds really cool for my mental health and for, my physical state. Let me consider that, so for a parent to also, remain open to different suggestions and possibilities.
I love that. I love that. And I'm going to add on, to be willing to be educated about those other modalities that you might not know about, because we all grew up in, you got problems, you go see the talk therapist.
Right. Mm-hmm.
And increasingly, and I'm happy to see this, I mean, you mentioned sort of other healing modalities, this notion of body work, for example, chiropractic, or even Reiki, craniosacral, massage therapy, physical therapy that's sort of more body oriented, fascia. All of that is very much a bottom up process.
Yes.
Which, if we're talking about anxiety, yes, we're talking about like human stuff and social media and all that stuff, but we're also talking about a nervous system that's dialed too tight.
Yes, exactly. And that's really important for us to address that, and I really like that you encourage parents also to be educated about that, because I'm a Reiki practitioner, I teach yoga, and oftentimes it's exactly what you say, have a parent that comes in and they're like, what is that? And of course, if the parent's not open to it, the teen is not open to it, I'm never going to say, let's do Reiki and balance your chakras. Like, no, I'm never going to force it. If they're like, no, that's not my thing, I don't want to do it, like, I'm never going to force that. And that being said, it can be really helpful to just inform people and also see if they're open to trying something new. And that's really where I come from as a therapist. I'm like, let's try something. Let's experiment. If it feels helpful for you, like, awesome. Let's roll with it, integrate it in a little bit more. And if not, like, let's try something else, or let's get another practitioner involved and let's collaborate with them. And you're absolutely right that often it's not just sitting and talking. And, of course, I'm an advocate of that too as a therapist, but there's more to it than that, and a lot of teens, it's wild. Like, they will sit and talk with a therapist just kind of face to face, and they're like, this isn't really flowing. And then they'll work, let's say, like with a coach that will go on like hikes or walks with them, and they're like pouring their heart and soul out too. So it really depends on the teen here. And that's why I'm very much like, I encourage parents not to discount or discredit other types of healing. And it's really about what helps the teen.
Oh, yes. Okay. So this notion of like bio individuality, we got
Yes.
to know who we're talking about. And
Yes.
two,
Yes.
listening is
Yes.
fixing.
Yes. Yes. It's a lot to absorb.
It's a lot to observe, but actually it's so interesting. As you were talking, I got some kind of image in my head about this kind of like a person who is supported from all sides.
Oh, I love that. And that's what we want. That's how we want. I mean, don't we all want to feel that way? I think even as adults, we want to feel that way.
We all want to feel that way. And when we allow ourselves to think that we get to feel that way,
Yes.
then doors start unlocking for us.
Yes.
And then we can also unlock those doors for our children, which is really, I think, honestly, more than half the time, I feel like parents get to their own healing and their own stuff through their kids because they're like, well, I got to do this for my kid. Oh, it works for me too.
Yes, yes.
Yeah.
And and I say this as a bit of a general statement, but that was really the intention of my book. And, I kind of forewarn readers in a kind of playful way that I'm like, just be prepared for a little self-reflection here. And it's not judgmental. It's not, oh, you're the reason that your kid is this way. Not at all. If anything, it's just to practice more compassion, more self-compassion, more compassion for the teen, having more empathy. And it's an opportunity for us to heal ourselves here too. And I think you're absolutely right. Oftentimes it's like, why would we have made these changes if we weren't kind of, faced with someone we love that's experiencing them, that when we help ourselves, it ultimately helps them, so it's kind of fascinating how it works, but it's not perfect all the time. And that's where I remind parents that if there are setbacks, if there are times where they're just really frustrated and they're like, oh my God, I just don't want to listen today. It's okay. It's okay. We're all human beings, and I never expect, parents to have it right. And that's a lot of my work I do with teens as well, is having the teens understand and start to have empathy for their parents, that the parents are doing the best that they can, even if it doesn't feel that way.
I love it. Okay. Sophia, if people want to get your book, what do they do? And if they want to learn more about you, what do they do?
So my book is available on October 7th, so you can pre-order it now. It's available on Penguin Random House, Barnes and Noble, Amazon. You can also contact me on my website, www.sophiagalano.com. You can follow me on Instagram, Sophia_Vale_Galano. I am happy to answer any questions about my book, about my work. I love speaking with parents, with teens, and any questions, I'm here for it.
Fantastic. We will link to all of that in the show notes. In the meantime, Sophia, this was a treat. Thank you.
Thank you so much. It was lovely chatting with you.